topic today of our live Instagram, responding to violence in healthcare. I'm Jeremy Faust with MedPage today. And this is a very important issue. I mean, look, we have literally 85% of emergency doctors said that violence has increased. And they're right. Here at MedPage, just looking through, we have covered this issue a lot. And I'm just going to read off a couple of the articles that we've published. Violence in healthcare. Why are people so angry? I didn't sign up for violence when I became a nurse. Violence in the emergency department is on the rise. Let's see. Confronting growing violence against staff. Violence against nurses worse than ever. Analysis find. The last straw. I mean, we just go on and on and on. And it seems like this is a problem that was not even discussed when I was in school. And now it's like every day you think is today the day. So let me just start with Sarah. Sarah, how did you get started with this issue as being, I mean, I get how important it is, but how did you start with this issue being one that you really wanted to take ownership of?
Yeah, I mean, I experienced workplace violence within the first 6 months of my nursing career, and I wasn't adequately prepared for what I was going to face. I made the mistake of, and trigger warning, workplace violence, I made the mistake of putting my stethoscope around my neck during my shift, and I received a report that my patient was alert and oriented ×4, and that they had no prior incidents. There was no reason for me to be really concerned when I walked into my patient's room. And I tried to do my initial assessment, and I had my stethoscope around my neck, and my patient actually tried to strangle me with my stethoscope. And in that moment, I froze. I had no idea what to do. I'd never received any training for how to get myself out of a situation like that. And not only that, but the CNA had actually happened to walk into the room around the same time that this was happening, and she'd actually frozen as well. She had no idea what to do. And we had locked eyes while I'm holding something that is potentially going to harm me, and I'm trying not to harm my patient in the process of trying to save my own life, I guess. And that was deeply traumatic. And what drove me to want to talk about this is that after that incident, I didn't know what to do. I didn't want to even report that this happened because I felt like it was my fault. I felt like I put myself in that situation and that I shouldn't have worn my stethoscope around my neck and put myself in that vulnerable position. Instead of like feeling some sort of emotional, instead of like trying to figure out the problem, I was blaming myself. And thankfully I did report this incident because that helped protect anyone else from the same experience with that patient. But we often don't report, and that leads to more harm and more incidents.
Yeah, I want to come back to reporting because that's a huge part of this. Thank you for sharing that. It's going to change your career and a moment like that. So thank you for sharing that with us. And I'm sorry that you had to go through that. That's just unacceptable. And that's why we're here. Steve, tell me about how you got involved in this.
Yeah, it's, as you mentioned, Jeremy, it's sad. Violence has become the status quo in the emergency department. That's completely unacceptable. Very, early in my career, I remember I was in the resus bay. We had a patient consented for treatment. Then he got angry, kicked a paramedic, punched a nurse, and young, naive Steve, early doctor, said, "Hey, this is assault and battery." Called some officers. They came in and told me they were more than happy to take my statement and pass it along to the DA, and nothing happened from it. The only time I've successfully had anyone charged is when an officer was actually standing at the bedside and witnessed my staff member get punched in the face and witnessed the bloody face, and charges were pressed. I was called to testify. I traded shifts. I sacrificed a day off, and I show up to find out the court date's been changed. Traded shifts, sacrificed another day off. Court date's been pushed back again, and then before the third court date got there, the charges had been dropped. Just this year, I was calling a family member to update them, let them know, hey, listen, there's a good chance that your family member is not going to survive the night, and was told verbatim, I'm on my way there right now with a gun, and if she's dead when I get there, I'm going to kill you. It's become commonplace. We have hundreds of stories. So, I'm very, very pleased to partner with the American College of Emergency Physicians to try to enact change. It's the status quo right now, and that's completely unacceptable.
Yeah, so there's two things that I want to explore a little bit with you both. And
Yeah.
one is about reporting internally, like to the hospital, and the support network that's supposed to be there and how that's going. And the second is what you just said, which is the hey, isn't this just a crime? Isn't this just like literally a battery? And why isn't there more legal action here? But let's start with the hospitals. That's where we all work. There, I think, well, Sarah, why do you think people don't report? I assume that it's for a lot of different reasons. One of which is like maybe there's a sense that nothing will happen. But what do you like? I hate emails and meetings, and if that's not going to make my life better, like why do it? But it's got to be more than that, right?
Yeah, and so we have weekly support groups through Don't Clock Out, and something that comes up very frequently is workplace violence. And a lot of the reasons that people come for support is because of their experiences. And many times these individuals talk about having severe incidents of workplace violence and feeling like it was preventable, but feeling like their management didn't want to have them report it. And we've had people who literally have been retaliated against by their institutions for reporting these severe incidents of workplace violence to the point where they've lost their jobs. And this is documented, this is factual, and it's heartbreaking. It's a tragedy. Not only that, they've gotten to the point where they feel like the only way they can get any sense of justice and also prevent this from happening again is to report to a news agency. And that's something that a healthcare worker that is in our support groups has done. And they have felt that this is like an immense weight, and they feel like a personal responsibility to address this problem. And that's not fair to these healthcare workers. It shouldn't be on them to make this massive system change when they were failed themselves, and they're having to navigate potentially a legal system and also potential disability from being injured from workplace violence. The other part of this is in training. Like, we're told that this is part of the job at times. We're told by folks who've been in the field for a long time that this is what you need to expect if you want to work in healthcare. You need to have grit. You need to be able to deal with the most difficult parts of humanity. But I don't think that's helping us. I don't think that's serving us. I think that that's leading to more omission. I think that's leading to incidents that should be reported not being reported, and healthcare workers feeling like, I had something really terrible happen to me. This doesn't fit in that category, so I'm just going to brush this off. But it does compound, and it does take a toll.
Yeah, and I think that what happens, as you said, is that people, they feel like if they escalate it, they're just going to be blamed. Instead of what can we do to prevent this, it's what could you have done to prevent this? Like, what did you do wrong, or what did you not do that was enough? Steve, how do hospitals handle this? Like, and also dealing with the patients, because the patients are sort of customers in some point, and we treat them like that, which may not be a good thing.
It's tough. I'm very fortunate that I work for a very supportive institution where we have constant security in the emergency department. We have, certain individuals that have demonstrated a pattern of violence are flagged. There's certain services, non-emergent services, they cannot receive because of their history of violence. But we're in the emergency department. We're directed by federal law to give anyone a medical screening exam that needs it. So I can't refuse service to anyone. There's a lot of, I'm very appreciative of my security staff who are, you can't just have random big guys. You need well-trained staff who know not to escalate things, but can actually de-escalate things with their presence. But really, this is a bigger issue than just my brain, our brains. We need standards. We need workplace safety standards. We need to make this an OSHA issue. OSHA assures workplace safety. This is a workplace safety issue, and we need to get the federal, OSHA involved. There's a bill that is actually pending right now. It's the Workplace Violence Prevention Act for healthcare and social services workers. This has already been passed by the House. This is a bipartisan bill. It's been introduced by Republicans and Democrats to set forth standards for workplace safety. Right? Any other workplace, if you had this pattern of safety issues with anything, OSHA would be all over it, and OSHA would set out patterns. These are the standards that you have to meet at your facility. I'm fortunate that I think my facility does a pretty good job, but we need to have standards across the board because, again, this is completely unacceptable.
Yeah, so just to kind of repeat a little bit of what you said, there is this bill, and I guess my understanding of it, just from what the coverage we've had in MedPage today and elsewhere, is that because it is designed to have OSHA, right, the Occupational Safety Health Administration, enforce something, that there's resistance to that on Capitol Hill, on one side, because anytime you sort of give more power to a regulatory body at the federal level, that's like a power grab. And so that's that philosophical opposition is what's holding that law back. Is that right, Steve?
Yeah, and it's, there's always the fear of unintended consequences. But when
Sure.
you have something like this, when the status quo is you have training set aside for what to do, not if, but when you are assaulted in your workplace, that is an unsafe working environment. And that's become the status quo. That's unacceptable. We're to the point where we need standards across the board. This has bipartisan support. There's Republicans and Democrats supporting it. And again, we've got to change the status quo.